You're going to learn about the most common cause of high ferritin, which is not iron overload, but insulin resistance, how to determine if you have it, and how to fix it. If you find this information helpful, please like and subscribe so more people can watch this video. My name is Dr. Thomas Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of The Free Diet. I've been blessed to have seen over 100,000 patient visits over the last 39 years, many of whom have gut and thyroid issues, and abnormal ferritin is a common thing I see. And this patient was one of them, a 44-year-old man. He was told to donate blood, and then his ferritin went up 100 points higher to 839. Normal for men is 30 to 400, although optimal is more like 50 to 80. He had fatigue, joint pain, anxiety, insomnia, and heartburn and other digestive symptoms. So the first step is to get the proper testing, and the minimum to figure out ferritin issues is a health panel that includes a CBC, comprehensive metabolic panel, lipids, TSH, ferritin, serum iron, percent saturation, TIBC, CRP, LDH, GGT, insulin, A1C, uric acid, and free T4, free T3. That would be the minimum to assess ferritin. I also like to check autoimmune markers, ANA, TPO, thyroid antibodies, thyroglobulin antibodies, reverse T3, the hormones DHEA, cortisol, testosterone, estradiol, IGF-1, SHBG, and at least the 3 nutrients of B12, folate, vitamin D. His results showed he had above optimal or high uric acid, insulin, cholesterol, LDL, triglycerides, GGT, and of course ferritin. His iron and saturation was not high, so he did not have iron overload. And his glucose and A1C were in the normal range, but his insulin was above optimal. Ideally, you want 2 to 4, and he was 10.6. And there's a calculation, it's called HOMA-IR, which you can use to figure out if you have insulin resistance. We multiply insulin by glucose, divide by 405. The reference ranges vary for this, but ideally you want to be 0.5 to 1. And this patient was 2.4, clearly indicated he had insulin resistance. So when you get labs and doctor says, oh, your blood sugar is fine, insulin, A1C, all that looks good, you're fine. Well, if you use this calculation, you can get a lot more in depth on whether insulin resistance is a factor like it was with him. Other functional testing indicated he had various deficiencies, toxins, food reactions, including gluten and leaky gut, high candida antibodies, and adrenal dysfunction. I put him on a specific diet and supplements, which I'll go over in a minute. And the end result was after 1 month, his ferritin dropped down to 202, and it was 839 2 weeks prior to seeing me. And the following improved to optimal levels: uric acid, insulin, cholesterol, LDL, triglycerides, GGT, and that HOMA-IR calculation went from 2.4 down to 1.0, which again, 1 or less is optimal. So that improved considerably, and he was feeling so much better, more energy, less pain, better moods, sleeping better, gut symptoms cleared out, and dropped 13 pounds of excess weight in that first month. So how we did that was with the Free Diet, which is a diet I came up with years ago when I was dealing with my own autoimmune Hashimoto's thyroid condition, rheumatoid, IBS, fatigue, skin, and other chronic health issues. So I was able to get better, and since then helped many others. It's a diet that's free of not only gluten, but gluten, grain, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods. All those foods most commonly responsible for inflammation, gut, thyroid, and other chronic health issues. For breakfast, you have a smoothie, and then lunch and dinner is beef, chicken, fish, plenty of vegetables with healthy fats. For insulin resistance, you want to avoid snacking in between meals and then avoid eating 3 hours before bedtime. I'll put a link for the Free Diet Phase 1 food chart below if you'd like us to send you that. And the following supplements: the Functional 5, which is multi-fish-oil, vitamin D with K, magnesium, probiotic, other gut supportive supplements, curcumin, and cardiometabolics, which is a berberine, alpha-lipoic acid, vitamin C, B complex, and other nutrients he was deficient in. You'll read online, don't take vitamin C if you have high ferritin. So he took vitamin C, his ferritin still came down over 600 points. He also ate beef quite often. Ferritin still dropped. When he only donated blood, his ferritin went up over 100 points. So it's important to identify the underlying root cause. Now, his hemoglobin was on the high side, which means he could benefit from blood donation. So once he was working on the insulin resistance side of it and donated blood, then that was really helpful. So if you have high ferritin, don't just assume it's from iron overload and just run out and donate blood. You really want to get the proper testing first to find out the root causes. Then you could be provided the right solutions. And if you do so, I believe almost anyone can get better. So thanks for joining me today. I'll put a video that goes into all 7 causes of high ferritin here. Free diet phase 1 food chart below. Feel free to like and subscribe. And I look forward to seeing you next time.